Her social life had become very constricted, with severe withdrawal and isolation. She described a predominant state of hopelessness and lack of motivation. Ms. Franco was found to be suffering from chronic post-traumatic stress disorder and major depression. A course of psychotherapy together with antidepressant medication was recommended. Unfortunately, Ms. Franco went on to receive neither psychotherapy nor pharmacotherapy and remained, at the time of my evaluation, anxious, depressed, and struggling to avoid any such thoughts, mental images, or feelings as might return her to the night of the accident. I agree that Ms. Franco suffers from chronic post-traumatic stress disorder. She faced a life-threatening situation, believed she was going to die, was present at her father's death, and was trapped in a vehicle with him under gruesome circumstances. The photographs I have been shown speak for themselves. It is unfortunate that a second psychiatric consultation was not obtained until more than 2 years had passed following the accident. And while her avoidance of mental health care professionals is understandable, it is exactly this avoidance to which healthcare providers should have responded. Eldon J. Chance, MD, Associate Clinical Professor, Department of Psychiatry, UCSF School of Medicine. There was more to the report, but that was the gist of the thing. Someone's insurance company had retained him to evaluate the nature and severity of her psychological trauma. Chance was a forensic neuropsychiatrist and made the better part of his living explaining often complicated neurological conditions to juries and/or attorneys, who would soon be standing in front of juries in cases ranging from personal injury to elder abuse to undue influence. He was sometimes asked for evaluations by other doctors, and sometimes retained by family members or estates. It was not the practice he'd once imagined, but it was the practice he had. He rarely saw someone more than once or twice, and rarely worked with them as patients. And so it had been with Mariella Franco. He had seen her only once, at the time of his evaluation. He did not know what had become of her, how her case had come out, or whether or not she had received any of the recommended therapies or medications. Nor, it no doubt goes without saying, was she the only patient he saw that summer. It was a season in which any number of cases might have occupied his thoughts. JC is a 36-year-old, right-handed white woman with a long and complicated medical history. The product of an attempted abortion, born prematurely at 7 months, she suffers a mild form of mental retardation, the result of oxygen deprivation at the time of the botched procedure and premature birth. The patient admits to a long-standing incestuous relationship with her father, and after 7 miscarriages, gave birth to a son with numerous congenital anomalies. MJ is a 42-year-old, right-handed black woman with several years of college education. The patient relates that at the age of 36, while walking from her job in a bookstore to her home in the Mission District, she was assaulted by a Hispanic male standing over 6 feet tall and weighing more than 200 pounds. She has only partial recollections of the assault, but remembers having her head struck repeatedly against a fire hydrant after trying to run from her attacker. MJ states that over the next year, she was extremely depressed and spent 12 months watching television or staying drunk. During this time, she acquired a handgun and would occasionally discharge it in frustration and rage. Her closest friend was a pet rat, which she says would come over and put its paw on her hand to console her. MJ currently lives alone in low-budget housing for the homeless and mentally disabled in San Francisco. LS is a 46-year-old woman who grew up with an abusive alcoholic mother. The identity of her father has never been made known to her. LS is at pains to present herself as an individual with learning disabilities. She states that as a young child, she seemed to learn everything backward. She would read not only individual words but also pages backward. If she is forced to read a book beginning at the front, she seems to have little sense of the story until she is able to read it again from the end to the front. Although the bulk of LS's time is spent caring for the 104 exotic birds she owns, her second greatest passion is reading about mental illness and learning disabilities. The patient states that for as long as she can remember, she has felt depressed, empty, and uncertain as to who she is. DK is a 30-year-old right-handed white male, last employed as a graphic artist in San Jose. Now 4 years status post a pedestrian versus